Deputy Director of the Rudd Center for Food Policy and Obesity. Well, we wanted to look at how patients feel about the kinds of language that providers use about their weight and how that makes them feel. And what we found is that words that are more neutral, like unhealthy weight or high BMI, are perceived to be less stigmatizing, less blaming, and more motivating for weight loss when doctors use those words to describe their body weight. What we also found is when patients feel that providers have used stigmatizing language to talk about their body weight, they're much more likely to try to switch doctors, and they also are more likely to avoid future medical appointments. And these were findings that were observed really across sample characteristics, so regardless of things like gender and race and body weight. And so what this tells us is that as health providers, the language that we use about body weight is really important. Well, as healthcare providers, we need to look first at our own personal attitudes. We need to think about the assumptions that we have about body weight, stereotypes that we have, and how this might influence our interactions with patients. We also want to look at the clinical office environment to look at what we can do with things like seating options, medical equipment to be more accommodating for patients with obesity. And we also need, as health providers, to make sure that we are using language that is supportive and empowering to patients rather than language that might be perceived as stigmatizing or blaming. Right now there's really not a whole lot of training on obesity or certainly not on weight bias in medical curriculum, and that's something that could really help address some of these issues by really addressing weight bias and its consequences for patients and educating students about these problems.